Thank you for staying with us. You're still watching Channels Beam on Channels Television. We're now being joined by Dr. Tade Ajao. He is a former one-day governor of Lagos State. He is an alumnus of OAU, a medical doctor based in Lagos. He is also a writer and an avid observer of the COVID-19 global outbreak. It's a pleasure to have you in the program, Doctor.
Thank you. Thank you.
Of course. So there's the problem, or there's a challenge of people not wanting to, go and access medical care because they think that, they just might be diagnosed COVID-19, for some reason. But what has been your experience? What have you seen in that perspective?
Obviously, there's been a lot of people who would just rather stay back home because they're both afraid, like you said. The general experience is that clients are patients, people would more likely not come to the hospital to see and some of them would just call in their personal doctors, home doctors, and see if they could just get some prescription over the phone or something.
Yeah. So it's good that you made mention of the fact that they can actually call in. So that brings in technology, telemedicine, telehealth. How has that been effective, in Nigeria? Looking at the fact that it's pretty much like a new phase in actually not even in Nigeria but globally. But let's look at its impact and how effective it has been here in Nigeria, where it is pretty much like a new form of accessing medical care.
Right. Currently, there is I must say that telemedicine has been on for quite some time.
Yeah.
We've had a couple of healthcare providers who thrive on telemedicine as their major platform there, and there is the incorporation or some integration of telemedicine services into normal healthcare services provided by maybe a couple of private hospitals out there. But on the public level, there isn't so much of that. There isn't so much of telemedicine. There wasn't so much of telemedicine services provided by general hospitals, provided by teaching hospitals, or public health facilities.
What do we need to do to make them come on board?
I believe at the moment we're looking at a new phase, a new period, we're looking at new realities. So we expect that a lot more input, a lot more resources will be put into ensuring that telemedicine providers come on board and possibly bridge the gap, because we have a lot of sick people. There's a lot of sick people at home who do not want to complicate their conditions by maybe visiting the hospitals and maybe getting COVID.
Yeah, but shouldn't that be the norm? Shouldn't that be what you should do when you have symptoms that, even though might not be COVID-19, but seem likely? You should subject yourself to medical test so that you can be certified either COVID-19 free or otherwise, and you can get the needed medical attention.
Well, besides our cultural setbacks or pullbacks, which would maybe result in some stigmatization, people not wanting to even find out their COVID status, the general practice in hospitals, in health facilities, even in developed climes, is to ensure that only people that need emergency health care or that are very unsure of their health care are the ones that show up at health facilities. So the advice, the general advice is to ensure that the general play is to ensure that a lot more people who have mild symptoms can access health care, right from wherever they are, without visiting the health facilities.
Yeah. So like you said, it's been on for quite a while. Telemedicine, has been on for quite a while. Is there a model? Is there a, so to speak, like a signature, like a country that has done this very efficiently? That we should pretty much be like borrowing a leaf from as we implement it here? Because I don't think it's been here for as long as you say it has been, in other places. So is there a country that you think that, we should model our own telemedicine and e-health, practices towards their own model?
Okay. The UK is always a great standard to look at. The US also, these are countries that have been channeling or been finding more innovative ways to provide healthcare service. A while back, Japan was Japan was experimenting with like Autobots, where you wouldn't actually need to see a doctor in person. You'd just pretty much be speaking with some screen, and you'd be able to access healthcare service directly. Because at the other end, there would be some doctor who's going through your symptoms.
Yeah,
pretty much as presented by the Autobot. So. Nigeria, I believe Nigeria, we still have a long way to go. We need programmers who understand what it takes, what we need, in Nigeria, based on our own realities, based on our own structures.
So we need to look inwards.
Yeah, we need to look inwards.
Yes,
and find a way to bring everything, bring the foreign,
maybe this would have been a good time
together.
For you to have been your one-day governor. Maybe you would have done things differently. Maybe you would have, employed those local developers.
Very well, perhaps.
Yeah, but thank you then again for joining us on the program and sharing your thoughts on this.
Welcome.
Hopefully, telemedicine would come even after the pandemic, would be here to stay and help people to access medical care from the comfort of their homes. Dr. Tadia
My
Jao,
pleasure.
Thanks for joining us on the program today.
My pleasure.
And that's the program today. Thank you so very much for watching. You can find the most viewed videos on our YouTube channel, on our website, on our Twitter handle, as well as our Facebook and Instagram pages. Thanks again for watching. I'm Victor Matthias. Bye for now.